Welcome to Sarpy Outlook. I'm Peg O'Dea Lippert. Our guest today is State Senator Jeremy Nordquist. Welcome, Jeremy.
Thank you, Peg. Thanks to you and to the Sarpy County Democrats for putting this together.
Well, we're delighted to have you. Jeremy is in his second term in the unicameral, representing Legislative District 7. And currently he chairs the Retirement Committee and serves on the Appropriations Committee. Jeremy was a key player in ensuring the minimum wage got on the ballot in November and that it passed by a vote of the people. Thanks for your persistence. Jeremy, this is somewhat of a follow-up to the interview we did a few years ago focused on the Affordable Care Act. Now, in addition to the Nebraska update on the status of the Affordable Care Act, we would like to focus on the Medicaid redesign as covered in LB 472. So would you start by telling our viewing audience the content of the Medicaid bill, its current status in the legislature, and I guess of recent, what does it mean to be bracketed?
Right. Well, I wish I was coming to present better news. We recently had a significant debate on LB 472, the Medicaid Redesign Act, and the idea of the Medicaid Redesign Act was to go beyond just saying we're going to take the federal money and expand our current Medicaid program. We wanted to do that. We wanted to make sure that those that fell into the coverage gap got coverage. But we also wanted, while we were doing that and bringing in those significant federal dollars, and I'll talk about that in a minute, but we wanted to reconfigure our Medicaid system so we're getting the most value out of the dollar. That is a big effort going on in healthcare nationally. It was a big part of the Affordable Care Act. But now it's down at the state level where we need to find ways to make sure that our healthcare providers are providing care in the way that keeps people healthy in the most cost-effective way possible. I think it's important, before we talk just about the Medicaid expansion in particular, that everyone has an understanding of what the Medicaid program is, because even a lot of colleagues in the legislature struggle to get their hands around it because there are so many pieces. It's obviously different than Medicare, where you qualify solely based on your age. Once you hit the age of Medicare age, you qualify for Medicare. Medicaid is based on different categories, and it's been a program that's been added to and expanded over time. And our largest category of eligible individuals in Nebraska are children, low-income children. We cover about 154,000 low-income children in Nebraska. There's 64% of the Medicaid population, but we only spend about 27% of our Medicaid dollars on that population. The other categories are pregnant women, very low-income parents, making only about 50% of the federal poverty level, which would be $6,000 or $7,000 a year. So very low-income parents can qualify. Also, our biggest cost components of Medicaid are for long-term care for seniors that have very low assets, people with disabilities, and people who are blind. Those are the largest categories dollar-wise in Medicaid, but the smallest population. So it's important that people just have an understanding of who currently qualifies for Medicaid. The Affordable Care Act gave states the ability to expand Medicaid for what's called the childless adults and other low-income individuals below 133% of the federal poverty level. So these are people who are working low-wage jobs, minimum wage jobs, at your favorite restaurant, your retail establishment, child care centers, people who cut your hair a lot of times, people who just don't have the dollars to afford health care on their own and are working in jobs that don't provide it. In Nebraska, that's about 77,000 people that we are now estimating that would qualify for this Medicaid expansion. The federal government in the Affordable Care Act said, states, if you do this, we will pay the full cost for the first 3 years, starting January 1, 2014, and then eventually that'll wind down to the federal government would pay 90% of the cost going forward, and the state would have to pay 10% of the cost. So if we look at projections for that 77,000 Nebraskans who, again, we know about 65 to 70% of them are working, so these are very much low-income working adults. That to cover that population between now and the end of the decade, the state's cost would be about $60 million to put in to cover it. That's our 10% share. and there are some cost offsets. We
Over
save
that
money
10 year,
over
over
that,
that 10
yeah,
year.
over that 10-year period. There are some cost offsets of programs that we fund now that we wouldn't have to fund solely with state dollars. So we have some savings there as well. That brings in $2.2 billion from the federal government between now and the end of the decade. And that's why we've seen 28 states so far and the District of Columbia take up this expansion. And now, just this week, we've seen Montana, their legislature has passed it and their governor's about ready to sign it. So they will now be the 29th state to sign on. And more states, the Republican governor in Wyoming has come out and said he wants to do it. And he's pushing his legislature very hard on it. Utah and Tennessee, those states are very much having a thoughtful debate on it right now. So we will see more and more states, excuse me, we will see more and more states, sorry, move forward with this in the coming months and certainly before next year. Where does that money go, the $2.2 billion? It's not just money that comes into our state budget and disappears. It goes out to pay healthcare providers. It goes out to pay hospitals, to pay doctors for the services that they're providing to these low-income individuals. These folks, unfortunately, have no other path to get health care. If you look at a family health care plan on the insurance exchange, and even before the insurance exchange, a family plan that had good coverage was going to cost probably $1,000 a month, or even more if you paid the full cost of it on your own. Well, in the insurance exchange, if you make above 100% of poverty, up to 400% of poverty, the federal government will help you pay that cost. If you make above 400% of poverty, so about $92,000 a year, you don't get any assistance. You're expected to be able to buy that insurance plan on your own, which if you make $92,000, you probably can afford a $12,000, $13,000 a year insurance plan. But the other people that don't get any help right now are those below 100% of poverty, and that's where this Medicaid component comes in. There's no way a family making $20,000 a year can go out and buy the $12,000 or $13,000 a year insurance policy. So that's why it's so critical that we come in and help those working families get the health care that they need, because the alternative for them is they wait until it's an emergency condition, they go to the emergency room, and they utilize healthcare services there. So the Medicaid Redesign Act expanded coverage for that population that's making roughly below $20,000 a year, to make sure that they can get preventative primary healthcare services when they need it, and also would have established a commission to look at how do we fix our entire Medicaid system to bring costs down, because we know we can't let it grow out of control. And there are a lot of innovative ways to do that. We've actually, little pieces at a time, done that in the state. We took on managed care for a lot of our population, which it can be good or bad, but we've done a pretty good job in Nebraska to make sure it's driving cost efficiencies into healthcare without adversely impacting the client. Essentially, we have insurers now who they have a financial incentive. They make money when they keep their patients healthy and out of high-cost care. So they're investing in prevention. Those are ways we can reform our Medicaid system to save even more money in the long run. So it was an overall package to improve our Medicaid system. Unfortunately, when we had the debate, we laid out the cost savings. There's huge economic impacts. Professors at the University of Nebraska-Kearney did a study which showed that we would receive tens of millions of dollars a year of new state tax revenue because of all that money coming in from the federal government.
They're recycling that dollar.
Right. And one more point about that money that the federal government would be we would bring back to Nebraska from the federal government. That is tax dollars that Nebraskans are paying into Washington. Under the Affordable Care Act, there were a few new taxes implemented, and that money is going to Washington, D.C. So the only way we get that money back is to expand Medicaid. And one of those penalties is just kicking in now, and that's called the employer mandate penalty for individuals, for employers who have, right now it's if they have more than 100 employees and they don't provide health coverage to those individuals, they have to pay a $2,000 a year penalty for each employee. So businesses in Nebraska right now, because we're not expanding Medicaid, are going to pay about $16 million in penalties to DC because they're not providing coverage to these low-income workers. So if we look at a competitive piece from state to state, if you're a business and you're looking between Nebraska and Iowa to open up and you hire low-income workers, in Iowa, your workers will get health care because they've expanded Medicaid, and you won't have to pay any of these employer penalties. On Nebraska, your workers won't have health care, and you'll be paying the employer penalty tax. So it really puts us at a competitive disadvantage. When we debated the bill, we saw that the votes weren't there. We probably only had probably somewhere, if we really came down to a final vote, we probably would have had somewhere between 22 and 25 votes. We would have needed at least 30 to override a governor's veto and 33 to end the filibuster that was happening on the bill. So what we did as proponents, we actually chose to what we call bracket, which is kind of, take the bill off the agenda for a specific given period of time, basically until the end of this session. So the bill is still there and can be redebated next year. We will have to, in the meantime, see if we want to continue with this larger reform approach of Medicaid or come back with a different bill next year. But this gives us the option to do that. Unfortunately, we have a lot of political grassroots work to do because it's clear that the senators who are opposing this aren't hearing enough, both from their constituents, from the hospitals that are impacted, from the healthcare providers that are impacted, and certainly from the 77,000 that are impacted. And sometimes that's a very tough population to reach. Those are people who are working long hours to make ends meet. So we have a road ahead of us, both inside the legislature, and there are some people talking about maybe looking at a ballot measure. And I think those conversations are going to happen over the next couple months, and we will see where we end up.
It seems to me, Jeremy, and correct me if I'm wrong, that in one sense, these are the poorest of the poor families in Nebraska, and I just don't understand what is the opposition to taking this money. We take it for other reasons, $4 million, I think the governor accepted, and for small businesses. But what is it? What is the problem?
It really seems like it comes down to just talking points on ObamaCare. The other side, that's all they're able to put forward is, Nebraskans don't like ObamaCare, which I would dispute, given the fact that we have about 74,000 Nebraskans who have actually signed up on the exchange, which was a very high number of Nebraskans who have gone and purchased the private insurance component of ObamaCare. Most Nebraskans think that, maybe there needs to be some tweaks to Obamacare, but most Nebraskans don't want to repeal it. They want to see us take advantage of the positive components of the law.
Well, that's our next issue then. So there is a direct link, of course, with this Medicaid option, if you will, and the Affordable Care Act. So what further is the status of the Affordable Care Act in Nebraska? You said 74,000 people have?
So we have a health insurance exchange at healthcare.gov, and this year there was an enrollment window from November 15th, 2014 to February 15th, 2015, and we went from about 40,000 the year before to 74,000 during this year's enrollment period. And our exchange is run by the federal government, as most states are. We did not choose to set up our own exchange. That does set us up for a little bit of an issue before the Supreme Court. There's a little bit of a discrepancy about what was intended in the federal law. Right, and we will see how that works out. And if the federal government, or if the Supreme Court rules against the Affordable Care Act, I think the steps are, I think states will say, should we go and set up our own exchange? But also, there would be tremendous pressure on our federal representatives. Even Republican Ben Sass has come out and said we can't pull the rug out from under these people. So we need to find a way to bridge. Now they would like to bridge and move away from Obamacare, help people for a little while and then move to something else. So there would be a very heated debate in Congress about how that takes place. The Medicaid piece is important because we've seen in other states insurance rates actually be better in the states that have expanded Medicaid, and it's a simple math piece because the hospitals, when they have to treat the people in the emergency room without that all gets shifted to the insurance company, which gets shifted to the consumer. Premiums are higher in all those states.
Well, what about the health cost in Nebraska? Has there been any impact, measurable impact, because of the Affordable Care Act?
Yeah.
Costs come down?
We've certainly seen in Nebraska and across the country that the rate of growth is slowing. We saw, through the 90s and 2000s, healthcare premiums growing, upwards of 10% a year. But we've seen in our small business market, we've seen it very much with our state workers and our state health plan, that the growth rate is now in, the low to mid single digits. So it's really slowed the growth of healthcare. I know that the president made a comment that maybe, and some people have taken it out of context, that people would save $2,500, and really, if you look at the cost savings, because the growth has not been what it was, those savings are real to Nebraskans. Otherwise, they would be paying a lot more in their premiums.
Well, I wonder also, Jeremy, about the insurance companies. They allegedly were somewhat opposed to this, but actually, I would assume their revenues have increased too, because more people are obligated to have insurance who previously did not.
Certainly, I'm not aware of their bottom lines exactly, but they seem to be doing very well. We haven't heard a lot of complaints. Even the piece that that we heard the most contentious about, it's called the medical loss ratio, where they have to spend at least eight out of $10, or 80 cents out of every dollar on healthcare services. That piece has actually saved consumers a lot of money, and that's one of the things why the rate of growth of the costs has slowed down, is because insurers now have to squeeze down their administrative costs and put more dollars into actually providing health care.
I love reading that report in the paper about the money that they have to refund to consumers. Well, thank you so much for your time and expertise in understanding all of this, and for that matter, all that you do. I particularly value your faithfulness to your values and your willingness to defend them on behalf of the voiceless in this state, Jeremy. Any parting thoughts?
Well, I would just...
Or call to action.
Right,
I guess that's the...
I was just going to say that. I would encourage all the folks listening to really get engaged. This is a critical issue. The Medicaid expansion piece, there are a number of legislative issues that are being debated right now, and I would encourage everyone to make sure that they let their state senator know their positions.
Thank you so much, Jeremy.